if you notice that it's starting to become soft again, or you feel it
I feel soft.
moving over to the right hand side or the left hand side, please let one of us know so we can assess that.
Amy, my hand hurts on the right hand side.
Okay. Well, right now we're doing a postpartum assessment.
Okay.
Okay. All right, so we are going to check your bladder next. We're going to check the contour of the abdominal wall to see if there's if it's sticking out over the symphysis pubis. We are also going to check to see if there's any distension. Luckily, the PSA did have you use the toilet before I came in to do my assessment. If you had not already gone, I would have asked our patient here to go to the bathroom, if able to, prior to the assessment, specifically for her comfort. If they do have a full bladder, it might also move that fundus out of place and we wouldn't get an appropriate or accurate assessment of that. Alright, we are now going to check your bowel. And as I'm looking at my paperwork here, it does say that you had a 3rd degree laceration in your perineal area. So if you don't mind turning over to one side, I can help you. Okay, so I'm just going to assess the area. I'm going to lift your buttocks up and I'm going to check to see if the stitches are intact, the redness, any swelling or edema, any drainage. Okay, it looks like it is doing okay for now. It is approximated. There are the stitches are still intact, and I do not see any drainage from the incision site. Okay. I'm going to go ahead and move you back over, Miss Nurse. Thank you for being very patient. No.
I'm going to pat you.
Thank you. Alright. So that position I just had you in was the lateral Sims position. And I used the Rita, which was the redness, edema, ecchymosis, drainage, and approximation. I also did not see any hemorrhoids present.
They're next to each other.
Okay. I am also going to check your pad as you were turned over to see if there's any blood or drainage on your waterproof pad underneath. I do not see any, which is also a good sign. Now I am going to evaluate your lochia. So at first, your lochia is going to be dark red, maybe a little bit heavier in the first few days than it is the following, right after birth.
Right after date of birth.
So you do have a moderate amount of rubra. If you are having to change your pad every hour or so, please let someone know. This is something that a doctor should be aware of, as you might be bleeding too much.
I'm going to look in the book and look at the pages. Here's the thousands.
As you go through and the days after you go home, your lochia should ease up and the color should start going from the red to light pink, and then approximately day 10 or so, it's going to start being a clearish or pinkish brown color, and it should be scant. If you experience a reversal in the lochia, so you go from scant to very heavy, that is something that you should immediately call your provider. you should be consistently seeing a decrease in that lochia and not an increase. Okay, another thing we are going to check for and test are your reflexes. It is very important for us to assess your deep tendon reflexes and for clonus. So I am going to check your patellar reflex. You may have seen this done before. You may have even had it done before. I'm just going to hit your right above your knee or below your knee and check your response.
Below my knee.
Okay, so you had a positive response there, +2. Check your other side. Okay, that was also a +2, which was active and the expected response.
So that equals +4.
Okay, so now we're going to assess for clonus, which is also called hyperflexia. Okay, so you're going to flex your knee up and support your leg. We're going to dorsiflex your foot, hold it for a second, and then release. Okay, so that's perfect. We had the normal response. Your foot returned to its normal position of plantar flexion. Now sometimes some moms experience the clonus response, which is the foot jerks or taps against my hand. That indicates that there is central nervous system irritability.
I'm at 17,000. Kibble.
Okay, so all this will be recorded. Okay, we're also going to check the Holman sign. So we will check for thrombophlebitis in your legs and check for any edema or swelling. Okay, we're going to dorsiflex the ankle. And do you experience any pain when that is
Yes.
done during that motion?
Yes.
Okay, the answer is no. Great.
Well, I think the answer is yes.
Okay, we are going to check your other side and we'll check to see if this one is experiencing any pain. Okay, do you experience any pain in your calf when I dorsiflex your foot?
No.
Great. Okay, we'll cover you back up. How are you doing? Are you in any pain? Sometimes that physical assessment may cause some pain.
Well, I have some pain.
Okay. Well, let me check here and see what orders you have, and I can get you some Tylenol, and we can finish up the rest of your assessment later. Okay?
Well,
Looks like you do also have Percocet available for moderate to severe pain. Do you mind rating for me your pain on a scale from 0 to 10?
yeah. Well, I think it hurts. 9. 9.
Okay, so your pain's a 9 out of 10. Okay.
I'm getting close to 10.
Okay.
See? It's because
I'm
I
going
said
to
9.
get your medication.
Okay.
Okay, perform the checks of my medication. Okay. Alright. I also have some information about Percocet here. I'm going to go ahead and give you your medication. If you don't mind just sitting up a little bit, that way you can swallow it easier. Okay, so just some information for you to read on your own. It's about Percocet. So you mentioned you've never taken this before. It is an opioid analgesic, so it is used for the moderate to moderately severe pain.
Okay, you have.
This can be excreted in breast milk if you are planning to breastfeed. Like
I want milk. 30 seconds.
This medication is typically prescribed after your delivery, and it is used typically
20
until
seconds.
the 3rd or 4th day when your milk starts to come in.
I want some milk.
Once your milk does come in and you are
10
breastfeeding,
seconds.
it is best to try to control your pain with a non-narcotic analgesic.
And there is.